And there's high unmet medical need in fibrosis with only a couple of antifibrotics on the market today. And so we are very excited about this program because it represents a novel approach to treating fibrotic disease. This program is also an amazing example of how we can use a single assay in order to answer many of the core questions that we need to ask in a drug discovery program. And so namely, I'm going to show you how we use Phenomics, generated right here next to us, to answer questions, to find hit compounds in order to deconvolute the MOA or the target of those compounds, and how we use Phenomics to drive compound optimization, both against the targets that we're interested in, as well as minimizing off-target liabilities. And we can do all of that with a single assay. So this program actually started out as a brute force screen. And for those of you who are unfamiliar with brute force, that simply means that we have to create a disease model, and then we have to put our whole entire library of compounds on top of that disease model to potentially identify hits. But you'll see we actually quickly transitioned this program to using map-based compound optimization. So we didn't stay in that brute force strategy for too long, thankfully. So our goal for this program was to identify compounds that could reverse the fibrotic state that we had induced in human PBMC cells back to a control state. And what you can see on this side of the screen is a number of our hit compounds, and you can see that very clearly we were able to identify compounds that reverted that fibrotic disease back to control at increasing concentrations of those compounds. So in addition to identifying hits, we can also optimize the compounds. So for those of you who are unfamiliar with how our chemists drive compound optimization, they'll take molecules much like the two that you see in the bottom here, and they'll remove some of these like R1, R5, R4 moieties. They'll put some on, they'll take some off, and they'll see what's important for driving either greater potency or potentially reduced potency. And that tells them what parts of the molecule are important. Now, the key take-home I want you to get from this slide, at the top you're seeing CRC curves, so you can see that when we apply the same compound repeatedly on this assay, we see very consistent results. And if we change out a couple of these moieties, so the R4, if we remove that one or change the R1 to an R2, we see 5-fold reductions in potency. And so this platform enables us to drive potency optimization. And for this program, we were actually able to drive potency optimization over 100-fold in order to get to our clinical candidate, which is now in IND-enabling studies. We can also use Phenomics to identify the mechanism of action for these compounds. So what I'm showing you here is a heat map, and let me orient you very quickly. So every row and every column represents a single perturbation, so either a gene knockout or a compound. The darker the red, the more phenomically similar, and so you can see perfect similarity along the diagonal with either compounds to themselves or gene knockouts to themselves. So now if we take 3 hit molecules that we identified in our brute force screen, and we run them now in our broad maps, we can start to identify what's the potential target or mechanism of action for those compounds. And you can see that 2 of our compounds here, REC-A and REC-C, look highly phenosimilar to the knockout of a target gene that we'll call Epsilon. And we were able to quickly confirm that these molecules do in fact bind to and inhibit target Epsilon. We also found molecules like D, which do not look phenomically similar, and that's denoted by the gray at the bottom, to this initial target. And if we continue to explore the map, we can identify what the potential MOA or target of those compounds are too. And it turns out that that is an MOA that we are uninterested in continuing to optimize against. So here now you're seeing a broader view of our heat maps. And I'm going to highlight here 4 tubulin-related gene knockouts. So you can see they're all phenomically quite similar to one another. And if we look, we see that those compounds which were not phenosimilar to Epsilon are in fact highly phenosimilar to these tubulin-related genes. And we were able then to quickly confirm that these compounds are in fact inhibit tubulin polymerization, which is not good. So inhibiting tubulin polymerization basically is cytotoxic for the cell and leads to cell death. So this is an MOA we wanted to stay very far away from. But now, if we go back to those compounds that looked, again, highly phenosimilar to target Epsilon in this map, you can see that they're not phenosimilar at all to the tubulin-related genes. So you can see how we can use this single assay to quickly drive compound optimization, both against targets that we're excited about, as well as minimizing these off-target liabilities. And this is very different from how traditional pharma companies would run compound optimization. So in a traditional pharma company, you would have to set up separate assays both to monitor on-target potency improvements, as well as you'd have to know what off-target liabilities you're looking for, and you'd have to separately screen for all of those. And most importantly for them is that that data is only valuable for that one program that they're working on. In contrast, for us, because we can use this one single assay to both drive on-target as well as minimizing off-target liabilities, we can also put that data, and Lena alluded to this, back into our broader data sets. And these to both improve future predictions as well as, and more importantly, and put this in the back of your mind, these compounds might be interesting starting points for future programs. And so I'll get back to that in a second. But this means we get a lot of value from the fact that we drive, or that we profile our compounds on just this one assay. So now, Lena shared with you our industrialized drug discovery process. Again, this was an early program, and so we only used a subset of the modules for this program, but you can see hopefully how we use a single assay like Phenomics to be able to drive on a lot of the core questions that we have in drug discovery.